Hi all, welcome to our Fascia Demystified channel. It's a channel or a simple initiation uh, to spread the knowledge of fascia and its clinical applications. It will be in a way of PowerPoint presentation, and let me share my screen. Thank you. This channel is intended to demystify the fascia, and we will introduce a very short and simple videos on fascia and its role in health and wellness so that you can watch or hear it at your convenience. I'm Dr. Demystified, and this is my Fascia talk show. This is you can say that a voluntary initiative to disseminate the evidence-based information and update on fascia and its function to a wider population with an aim to improve human health and well-being. The intention is simple: to disseminate the knowledge. The information presented in this series are searchable and reproducible. Further information, clarity can be obtained by contacting the presenter directly. Or about myself, I'm Dr. Demystified, and I'm a fascial enthusiast and a researcher with nearly, let's say, 15 years of experience in this field. I do research, education, some clinical practice pertaining to fascia and its dysfunctions, and was lucky enough to have some high impact research and presentations in fascia and facial mobilization practices, and many more research papers are there to come out. So the introduction: musculoskeletal pain and dysfunction are amongst the leading reasons for visit to physicians and manual therapists, and are the most common cause of long-term chronic pain affecting people worldwide in the range of hundreds of millions. Without proper treatment, chronic pain can have a strong destructive impact on an individual's physical, psychological, and social well-being. At the societal level, pain creates a tremendous economic and workplace burden, as the prevalence of musculoskeletal pain is projected to rise with a sedentary but longer living worldwide population. It calls for greater effort in the development and evaluation of a new way of managing these patients. There is a global call for more integrative type of approach than so-called specialty approaches, which is happening now. And the word holism, psychosomatization, mind and body, etc., are claiming much attention and evidences than previously. The so-called neglected tissue, our fascia, is now getting heavy attention based on the current histochemical and biomechanical evidences. So fascia is ubiquitous, that means continuous tissue permeating the entire body. It surrounds, supports, suspends, protects, connects, and divides muscular, skeletal, and visceral components of the organism. It not only lubricates the fibers, but gives nourishment to all parts of the body. The tensional network of fibrous tissue around the body includes dense sheet of muscle envelopes, aponeurosis, as well as specific local adaptations such as ligaments and tendons. Fascia is the second most highly innervated structure in the body after the skin. The importance of fascia to normal function has been recognized by hands-on practitioners for more than a century. But it is only recently that it has emerged as a significant contributor to mainstream orthopedic, let's say, musculoskeletal knowledge. Studying fascia objectively at the basic science and clinical levels will provide important information that may change the clinical practice. On the structure and functions of the fascia in the musculoskeletal system are further elucidated. The pathophysiology of many disorders and their consequences may be better explained. This is our hope. Many neuromuscular and musculoskeletal disorders can be additionally served by research on the fascial perspective in order to optimize treatment strategies. We are going to talk about something we missed earlier. When we started learning anatomy, we were so curious to dig in to see what is inside of the body before we are thinking about what is protecting it, what is covering it. We care the skin because it was so sensitive and a socially acceptable system, so we cut it very carefully. We miss the fascia and the role of fascia both macroscopically and microscopically, and we miss the most important cause of chronic pain and dysfunction. Recent studies have demonstrated the role of fascia in various musculoskeletal dysfunctions as the fascial tissue connects every skeletal muscles and organs, forming a body-wide web in a traceable pattern. Otherwise, these are called meridians or chains or connections, which were the basic principles of many ancient medicines and martial arts of the world. So our ancestors were able to identify all these things, but we missed it. It is a time to discover the inseparable connection between the mind and the body. It is a time to know the unknown or missing link of mind and body connection. It is the time to redefine the health and wellness by placing the fascia in its position that it deserves. And to ultimately to understand that human body can't be seen as a separate unit, but should be seen as a single coordinated functional system, and we used to otherwise call as facial continuum. Why the fascia is still relatively unknown? $1 million question. Maybe one reason is it's a new field of research. Fascial research is not more than 40 to 50 years old. It has been fragmented and disintegrated during the majority of the time. The first Fascial Research Congress was held in 2007, from where the things started connecting, marking the start of unifying ongoing research around the world. And maybe somebody can say that it contradicts the previous knowledge. That's why there was a resistance to accept the fascia. The new research findings turn previous knowledge about the body upside down. Or we can say it's a new paradigm and a new perspective. Fascia experts believe that the fascia research will have the same groundbreaking impact on the paradigm shift for biology as the difference between Newton's mechanical universe and Einstein's E is equal to mc squared. A bit pretentious, maybe, but in the way it is like hearing about Earth being round when you always have thought it to be flat. It was the beginning, it was very difficult that time to say that the Earth is round. Old perspectives, beliefs, and habits die hard. The new is often difficult to accept. And the fascial enthusiast, believes that this is the main issue what we are. I just want to mention somebody's name here. There are a lot of names has to be mentioned in the first presentation, but we'll be presenting in the upcoming presentations. This is Dr. Jean Cloud in Batu. It is Dr. Jean, a hand surgeon and author of the famous film Stalling Under the Skin. This film shows for the first time the most fascinating images of the living fascia using a special endoscopic camera. So when there is a possibility, try to see the Stalling Under the Skin. I think it is around 28 minutes of video, so you can just move in between. And Dr. Jean has a very famous quote: "For several hundred years, anatomists and surgeons like me have neglected this tissue, which is the fascia, since it does not seem to be something that is there." It was very silent, you know. But the fact is that it is not just something, it is everything. And we feel the same. The fascia facilitates all communications between every single body part. Fascia is the most innovative structure following the skin. This is where we have our whole intellect, insight, and feeling. So this is the first part of or introductory part of the fascia. These are the we'll be having small such videos uploading in a timely intervals. We'll try to explain the fascia as much as possible. Thank you for your valuable time. So try to share this information because we want more people to know about the fascia. And please like, subscribe, and share these videos so that you will be getting the notification for the second videos, 10 videos, and all. Any doubts, any discussions, any issues, please reach me at fasciadoctor@gmail.com. The next section, wait for it, Fascia Explained. We'll be giving the basic information on the fascia. So wait for the next section. Until then, bye-bye.